Okay. Ready to go.
Good afternoon, everyone. On behalf of India Association of North Texas, its board and trustees, I welcome you to this webinar today. It is the spring equinox day, the first day of spring. And of course, we are all waiting for this day. It's after the long winter and of course, just before the summer. Blossom by blossom, the spring begins. And spring brings new life, new beauty, new colors and fragrances to this world. And what a beautiful day that we are all here, and thank you for joining us. Today we have a great webinar and a very relevant topic. It is about COVID-19 and vaccinations. But before we start this webinar, I would like to read the disclaimer. By attending this webinar, you agree to be recorded and also not to hold liable any organization or panelist participating in this webinar. The purpose of this webinar is for spreading community awareness along with education and prevention of the COVID-19 pandemic. Its content is not to be constituted as expert medical advice. Information provided here is generic. For specific individual needs, please consult your physician. Information shared here may have been collected from different sources. This does not supersede any recommendations of the CDC or your local health department. So now I would like to introduce Mr. Shailesh Shah. He has been serving the local community for more than a decade. Mr. Shah is also the current president of the India Association of North Texas, and he is also the moderator of this webinar. So with this, I welcome Mr. Shah.
Thank you so much, Susmaji. And Susmaji, thank you. And she's also one of our board of directors for India Association of North Texas, and she's been involved with other community services as well. Thank you for the nice introduction. India Association of North Texas welcome all our viewers today to another session of COVID-19 awareness. It's almost a year for the COVID since started in March 11th and changed many lives. Our deepest sympathies to all who have faced hardship and pain. India Association of North Texas Board of Directors, Trustees and Volunteers stands by the community, and we want to repeatedly remind you that we are here to serve and stand by to the best of our abilities. As a part of these efforts, it gives me a great pleasure to introduce our panelists today, who will help us understand more about the fast-changing COVID-impacted world and how we can protect our community. To learn the science behind this, let's begin our conversation, and I would like to request all the top panelists today to introduce themselves. So let's start with the Dr. Nainesh Shah. Then after we're going to have Vijay Sarma. Then after we're going to have Dr. Nikhil. So Dr. Nainesh Shah, please.
Hi there, my name is Nainesh Shah. I'm a physician at UT Southwestern working at Parkland Hospital. And over the last year, I've been taking care of COVID patients that have had to be admitted to the hospital, that are sick enough to be in the hospital.
Great. Good afternoon. Once again, I'd like to thank the Indian Association of North Texas for having me. I'm Nikhil Bayani. I'm an infectious disease specialist. I work as an infectious disease consultant at various Texas Health Resources hospitals. I also serve as an infectious disease advisor and hospital epidemiologist for the Texas Health Resources health system. Just to give you a background, Texas Health Resources, we're one of the largest nonprofit healthcare organizations here in North Texas. Mainly, I work out of Texas Health Harris Methodist Alliance Hospital, which is in North Fort Worth, and also at Texas Health Harris Methodist HEB Hospital. So we have taken care of a large number of COVID patients, and also from a system level, based on the CDC guidelines, the World Health Organization recommendations, and also the Infectious Disease Society of America, we set forth and put out the guidelines to help our care for our patients and also maintain the safety of our employees and colleagues within the hospital during this pandemic.
Good afternoon, and hello to everybody. Mr. Silesha, the president of IANT, and thanks for IANT to do this community work. They have been doing plenty of work, including the healthcare webinars and many other, along with our organization, which is TIPS, Texas Indo-American Physician Society. I'm ex-president, and Dr. Vianney is present board member for the TIPS. And today, hope will convey our information, some message about COVID disease, up to date, some treatments, and especially the vaccination. What we know so far, and where we are going, and what we have achieved. Hopefully, this will help our community to know more and understand more both disease and vaccinations. So hopefully you will have a good webinar. We'll try our best to give as much information as possible to you.
Thank you so much, all the panelists, for a nice introduction of yourself, and we really appreciate for taking some time from your busy schedule and helping our community here. We really need to. So the first question is just almost 1 year into the pandemic. Can we recap and what is the COVID-19 as originally started? Dr. Vijay Sharma?
COVID-19 disease caused by coronavirus. Coronavirus is there, known to us for many years. We are specialists here for Dr. Nikhil Vianney. Agree to me, 2004, 2005, and before that, we have these coronaviruses among us. And the two diseases, SARS, severe acute respiratory distress syndrome, and MERS, Middle Eastern respiratory syndrome. That's when we came to know about this SARS virus too. But until 2019 December, when we got this novel COVID-19 virus, the difference between that SARS-2 and COVID-19 now novel viruses is that so far it did not infect the human being, man, woman, human beings. It was a zoonotic disease. It was among the animals only. So that's why it was called that time as coronavirus, and now it's novel coronavirus because it infected the human being. Now, we came to know, I think, December 2019, and we fought hard to find what is going on. As everybody knows, it started from Wuhan in China, spread to almost every country, and very much hit country to begin with was Italy. Our own nation is highest number. Our own home nation, India, is still suffering. Some places is still continuing. And no definite treatment other than dispositive treatment has been recognized, other than, I think I can say to some extent, the monoclonal antibodies, and now the vaccination came. I'm sorry for people who lost their lives because of this COVID. And it is one of the biggest pandemic I have seen in my lifetime. So we started with many different treatments for this. Number one is respiratory disease, spread by respiration droplets. When we're breathing on each other, cough on each other, we are among each others. but it can also be transmitted via contact, but not direct contact, some infected contact communicating with us. So the universal precaution we started with 6 feet distance, cover your cough, cover your breathing, put the mask on, wash hands. And then we started using supportive care in people who are sick. Then the test came, rapid test, PCR testing, which gave us the numbers. And then different medications we tried, failed, yes, no. Dr. Vianney can also tell you more about that. And finally, I think we can say still experimental monoclonal antibodies came, and finally with extensive workup, united workup for all the scientists in the world, and with the day and night, and I would say multiplied efforts, the vaccine which could have not been possible in many years, we created it, I think within 12 months or so, not wrong. And the first vaccine in the United States came end of December 14th or 15th, which is Pfizer, and 1 week after Moderna, and now Johnson & Johnson. So we started from disease, which is killer disease. We do not know anything. We found what it is. We got the sequence, and now we got the vaccine. And many of people has been vaccinated, so much so that those who are vaccinated, they're not wearing masks, are based on the recommendation of CDC, but we still want everybody to take as much possible universal precautions. So this is in a nutshell from December 2019 till March 2021.
No, great. That was a great insight out. So they're wonderful. Thank you so much, Dr. Vijay Sharma. So the next question that I relates to, like, what is the COVID situation today with emerging new variant across the globe and the UK, South Africa, and Brazil variant strain? Dr. Nikhil, can you elaborate on that situation, please?
Sure, definitely. So as we are seeing right now, by the way, Dr. Sharma, that was a very good recap of the pandemic and the treatments. And as we can see, as the virus is around, it's going to replicate. And of course, we're going to see variant strains, just like very similar to the influenza virus. We see different strains, different variants. And the variants that we are seeing, of course, the first one that was identified very commonly is the UK variant, then the South African variant emerged. We have the Brazilian variant, and of course, in the news just recently, there were 2 new Southern California variants that were identified. And how these variants arise is because on the mRNA, there is a change in the RNA material, which produces a different spike protein. And just to use this example, it's like, when you go to a fashion show, the different models are wearing different outfits. They're walking down the catwalk. It's the same thing over here. The SARS-CoV-2, the spike protein, it rearranges itself. Now, of course, the big question comes up. The vaccine came out in December, and now the vaccine was developed towards what we call the wild type, meaning there's no mutation of the virus. And now you have variants emerging. How well do these vaccines are protective against these variants? And from what we know so far, the UK variant, the antibodies produced by the Pfizer and Moderna vaccines do have significant activity against the UK variant strain. Now, of course, the South African variant strain and the Brazilian variant strain, there is decreased efficacy. But nonetheless, should that stop you from getting the vaccine? No, because the vaccines do provide some degree of protection and reduce the severity of the illness.
Yeah, so that's very good. So, Dr. Nilesh Shah, do you want to add anything to the one about the COVID situation with the different countries and identified in California as well? So, anything you want to add into before I go for the next question?
No, that was a great recap, Dr. Bayani. We're still learning about the new variants, but luckily right now, the vaccines have shown that they are able to at least help people from getting severe illness. And so that's the main thing that we're looking for, is to make sure that the vaccines are still going to be able to prevent people from getting sick enough to get into the hospital or dying from the disease.
Right. No, that's great. So I've been hearing also from Dr. Sharma and Dr. Nikhil and Dr. Nines. So what is the difference between the two different vaccines, like Moderna and Pfizer, and we've been hearing Novavax, and so what is the difference between all those three? Is there anything you can help us to understand the community and the citizens of that here?
Sure. So one thing, the Pfizer and Moderna vaccines, both of them are mRNA vaccines. So the way this really works is through nanotechnology and the formulation with nanoparticles. You're actually injecting the mRNA into the individual, and that mRNA is taken up by the cell. Now, keep in mind, the mRNA does not affect the DNA, the human DNA whatsoever. It's not going to alter your genetic makeup. So that mRNA is presented on the cell machinery that produces a spike protein. And then once that spike protein is produced, the remainder of that viral RNA material is pretty much discarded by the cell. And that spike protein that is produced is presented to the cells of your immune system. So when you're exposed to the SARS-CoV-2, the virus that causes COVID, your body knows, okay, hey, this is the virus, the antibodies will go after that. So basically, you're producing the spike protein from the genetic material that the virus has. Now, of course, as we know, the Johnson & Johnson vaccine is very interesting. It's the adenovirus that is decorated with the spike protein, which is injected into the humans. And the human body produces the antibodies towards that spike protein. And of course, the Novavax is in phase 2 and phase 3 trials, which they take it a step further. What they're doing, they are replicating and they're producing spike proteins in bats. And those spike proteins are harvested from the bats, and through nanotechnology, using the form of nanoparticles, it's re-injected into the human being.
Okay. So, Dr. Nines, if I have a choice, do I have a choice to select, pick and choose which vaccine I should ask for them to give me, or how does that work?
So right now, what we've seen is that all of the vaccines are very effective against moderate and severe disease, meaning they're all going to work to prevent you from getting so sick that you're either in the hospital or that it'll prevent you from dying after you get the virus. And so they're all effective in that regard. And right now, with the way the vaccine distribution is working, the recommendation is really just to get whatever vaccine is offered to you. There's no one population or one set of people that do better with one vaccine versus another. And right now they all do what is the most important, which is prevent you from going to the hospital or from dying from the disease. And so with all of the lines that we have and the vaccine is still not available to every single person that wants it, the recommendation is if you get offered the vaccine, go ahead and get whichever one. And there's not going to be one that's better for you versus another. So really just if your name is called to get the vaccine, just go get it. It doesn't matter which one you get. The one difference with the Johnson & Johnson, just so everyone knows, is that it is a one-shot vaccine. And so with one shot, you don't have to go back to the clinic or wherever this vaccine is being given. With Pfizer and Moderna, it is 2 shots. And so you will have to go back. With Pfizer, it's after 3 weeks. With Moderna, it's after 4 weeks. But that's one of the big differences in just how you get the vaccine, but again, it's really good to just get whatever vaccine you're offered.
So that raises another question, Dr. Nines, is like if I got the Pfizer first dose, so do I have to get the second one, the Pfizer itself, or can I have a pick and choose, or does it automatically apply the CDC guidelines to get the Pfizer's only the second dose?
Yeah, that's a great question. And studies are being done to actually answer that question right now. In the United States, though, the recommendation is to stick with the same manufacturer. So if you get the first dose as being Pfizer, the second dose also you should get as Pfizer. And in most places where they're giving vaccines in the Dallas-Fort Worth area, usually they'll set you up for your second dose and they'll know what they gave you and they'll make sure you get the same manufacturer. And so it's nothing that you really have to consider or think about. Try to go back to the same location that gave you your first shot if you're able to, and they should be able to give you the same manufacturer. That being said, maybe Dr. Bayani has more information on this, but the thought is that even if you do switch from Pfizer to Moderna or back, it probably won't matter too much. And I know that there are studies actually ongoing in Europe trying to study if this is okay or not.
Dr. Nikhil, do you want to add anything to this comment?
Yeah, no, that's a very good point that Dr. Shah brought up, that the vaccine clinics are very good, that if you have received your first dose as Pfizer, you'll come back in 21 days and get your Pfizer. With Moderna, you come back for 28 days. The CDC just added new guidance about a little bit over a month ago that, let's say if somebody moved from out of state and they do not recall which Pfizer, Moderna vaccine they got, but they're due for a second shot, it is okay in dire circumstances to interchange one of those brands, either Pfizer or Moderna. However, it should not be a practice that should be implemented routinely.
How about Dr. Sharma?
Yes, sir.
Would you like to add anything?
No, I will not add, but I want to talk a couple of different points. I hope most of our listeners, they are medical person, but some are not. While talking about the vaccines, what it is. So we have this coronavirus. How we prepare the vaccine, how we inject, how it produces antibodies in our body to fight the incoming, if there's any infection of COVID. So any part of the virus, COVID virus, can be used to inject in our body without harming us, our genetic system or our immune system, or without injecting disease itself. It could be like mRNA, which is one of the RNA part. It could be part of the DNA. It could be part of the cell itself inactivated, or some part. So something we inject in human body, and they stimulate or stimulate the immune system to produce antibodies in our body, so that they can fight against in case person is exposed to that virus again. We get 2 shots or 1 shot, depending upon the studies, how much immune system is produced in our body. Like Moderna and Pfizer has 2 vaccine each. So mRNA is Moderna and Pfizer. And as we said, that third Johnson & Johnson, we have DNA. And like in India and some other places, there are inactivated viruses are being used. And in some places, part of the proteins which are injected. So the different ways of making the vaccine, the whole purpose is that it should go into our body without harming us, without causing virus disease to us. Like sometimes we say in flu vaccine, you can get disease, but not here as far as our knowledge goes. And they produce the immune system in our body. Because one vaccine which has 2 doses should be followed by same vaccine should be repeated, as Dr. Nikhil Bayani in dire cases. But this is an advanced question from me to Dr. Nikhil Bayani. I was reading a few days ago about allergic reaction to some of the vaccines. So if there is any studies that if you develop allergic reaction to one vaccine, and you recommend that you should have the second dose, should we use a different category of vaccine, not mRNA? Instead of mRNA, we can use the DNA type of or inactive vaccine. So that question was, the allergic reactions are very rare. I think 11 per million or something like that.
Right.
So that's what I want to add as to vaccine.
So what we have learned about the mRNA vaccine, Dr. Sharma, about the allergic reaction to, first of all, if anybody has anaphylaxis to any vaccines, they should not be getting the mRNA vaccines. As a matter of fact, they should not be getting any COVID vaccine, just because there's a lot of unknowns about it. But the most common delayed hypersensitivity reactions, allergic reactions we are hearing about is the folks are reacting to the component there, polyethylene glycol, the PGE, the PEG. And some people, because the body sees it as a foreign substance, so there is some folks who develop rashes, and at that point, at first we just said, okay, you know what, don't let that deter you from getting a second dose. However, the CDC did come out with guidance saying that, hold off on getting a second dose, because we really don't know what the reaction could be to. However, if you want to get that second dose, you would have to consult with an allergist before you get that second dose. So my recommendation would be, if you had an allergic reaction to the first dose, consult with an allergist before you proceed with another second dose or another brand of vaccination.
No, that's very good information, very good tip, Dr. Nikhil and Dr. Sharma and Dr. Ninesh. So the next, I've been getting a lot of viewers' questions right now. So I think this is a common question that I'd like to have Ninesh to address. Can we get COVID after getting vaccine, be carrier and impact others?
Yeah, so the question is, after you get vaccine, so the first thing is the vaccine itself cannot give you COVID. So the vaccine, as was described by Dr. Rayani, it's not actually the virus that's being injected into you. So you cannot develop the virus infection after you get the vaccine. That's the first thing. The next question is a little bit harder, which is, once you're vaccinated, can you still get the virus, and can you still spread the virus to other people? And we don't know 100% on that, what the answer is going to be. What we say is that there's still a chance that you can get the virus. There's still a chance you might get a little bit sick or feel a little bit ill from coronavirus. And even if you don't feel sick, which most people are not going to feel sick, even if they get in close contact with someone with the virus, there's a chance that the virus can still be in your nose, it can still be living on you. And when you go and hang out with somebody who doesn't have the vaccine, who has not had the vaccine yet, and you're breathing and you're talking, there's a chance that that virus can then go to that other person. It's a low risk, but I believe it's still a risk, and until we can prove that it's no risk, I would avoid, even if you're vaccinated, you have to protect other people. And so if you're going to be around anybody who's not vaccinated, the recommendation is still to wear a mask, because it is theoretically possible that you can still give them the virus if it's somehow living in you, even though it's not making you sick.
Okay, so I got another question also from the viewer. If somebody is trying to be pregnant or is pregnant, and recommend on that situations, do they have to take the COVID dose right now, or should they wait, or what do you recommend, Dr. Ninesh?
Sure. Yeah, and then I'll let Dr. Bayani chime in as well. The initial studies didn't have anybody that was pregnant at the time that the study was started. So whenever they did the virus and they studied whether or not it was safe to use, all of the patients that they first experimented and gave the vaccine to, none of them were pregnant at the time, or they didn't know that they were pregnant at the time. And so all of the studies that we have didn't have anybody that was originally pregnant. what we later discovered is in the studies themselves, some of these people that got the vaccine actually were pregnant. They didn't know it at the time, but they were pregnant, or they got pregnant soon after the vaccine was given. And in those patients, there was really no harm. There was no side effect to either the mom or the baby. And at this point now, that it's been long enough where these babies have been born and they haven't noticed anything in terms of side effects or any sort of ill effects. And so the recommendation initially was to speak to your doctor, make sure you understand the risks and the benefits. And overall, the overarching recommendation is still that if you're pregnant, you should still get the vaccine. From everything that we know, it's still very safe for both pregnant and breastfeeding women. And I'll let Dr. Bayani add to that. I'm sure he has more info.
Yeah, no, that's a very good explanation here. So to this day, definitely pregnant women, the vaccine has been safe in, women who are pregnant and who are also nursing. However, one thing that is strongly recommended from even an expert panel, even from the Infectious Disease Society of America and also the Centers for Disease Control, the CDC, that definitely consult with your OB/GYN just to make sure that it is safe during the pregnancy to take it. But overall, the safety data that we have seen, there have not been very many or significant adverse events reported during pregnancy.
That's great. How about Dr. Vijay Sharma? Would you like to add something to it?
So when I was reading on this very early, I believe China has some cases they studied, and that's what based on what we're saying, and there was no harm from the disease. I think first and they are doing good, and I think vaccine. But I don't know, Dr. Bayani and Dr. Nagesh, that guideline-wise that the CDC does recommend. Does not say anything, or you use your own comments. There's not enough data. Am I right on that, Dr. Bayani? You're expert.
That is very correct, because there was not, when they sampled over 44,000 folks, there were not that many pregnant people in the trial. So the data is limited.
And Dr. Nagesh and Dr. Bayani, my question, in our community, I do not know so far. People ask me, any pregnant woman got vaccination? Do you know somebody got? One is data internationally, second nationally, third is community-wise. So the woman came forward and they took. Yes, some people were hesitant taking the vaccine because they may become pregnant. They are taking it. Some young ladies, they were hesitant that we do not know what will be the long-term effect of the vaccination. That is overcome. But those who are pregnant, I do not know. So how many, if we count, they have the vaccine and they decided to take the vaccine. It's a comment, but as your own choice, and definite guidelines by CDC. Dr. Bayani, is there any clear guidelines like flu vaccine? I pull data, tell the people, hey, it's a safe, take it. And like Tdap, sometime they gave it, something third, they gave it. For this particular vaccine, I don't know, and we need much more clarification, maybe more data or something. And those who want to save, since whatever we have, there's no harm that. So.
One way to look at it, definitely, when these clinical trials were done, the power of the pregnant women, of course, was very small. And two, the thing that you really want to look at is from this perspective. Let's say if you have a 28-week pregnant woman, if she catches COVID from maybe a coworker or a family member, her chances of developing a severe illness, which could jeopardize her health but also the fetus, versus getting vaccinated. And when we have looked at the clinical trial data and also data from overseas, that the benefit of the vaccination outweighs the risk, you rather want to proceed that way. And that's where I think the CDC has left that disclaimer that if you choose to get the vaccine, keep your OBGYN in the loop, consult with them. Just because there could be additional information reported by the American College of Obstetrics and Gynecologists. However, I'm sure that more studies are being undertaken with pregnant women, but at this point, I think it is relatively safe. I've had 2 nurses who have come up to me that I work with in the hospital who are pregnant. They did receive the vaccine, and luckily, there was no adverse event. So I think the take-home message here is that if you're pregnant or you're a mother who is nursing, definitely get the vaccine. However, do consult with your OB.
Great. Dr. Nainesh, do you want to add anything to it?
Yeah, I'll add a little bit. I work in a big group, so between Parkland and UT Southwestern, there's a lot of young people, nurses, doctors, and so I know at least personally about a dozen people are at various stages. Either they got pregnant right after the vaccination, or were pregnant, or are breastfeeding, and all of them thankfully did well and didn't have any side effects, and those that have already given birth, the babies were born healthy. And this, even though the vaccines were initially, there were studies and it's very rigorous and controlled, and they monitor the side effects. The other thing that the CDC did, which was really good, was they came up with a central system so that you can report side effects. So it's not like people are having side effects and people just don't know. So there's a system where people are reporting side effects. So even though the initial studies didn't have a lot of pregnant women, at this point, a lot of pregnant women have received the vaccine. And even with all the information we know, with all the people that have gotten the vaccine now, I haven't heard of anything that says that there's a risk. I do agree that you should consult with your OB because there's always different people have different health issues, and so it's always a good idea to keep your doctor in the loop. And the other thing I'll say is that I've taken care of pregnant mothers who have died from this virus, and so like Dr. Bayani mentioned, it's a risk benefit, and anybody who's pregnant is high risk if they get the virus. So when you think about it for your own self, consider what is your risk of getting the virus. Are you leaving the home at all? Are you around anybody that could give you the virus? And if that's the case, then you should probably consider the vaccine pretty strongly. Now, if you're going to stay at home, not see anybody for your entire pregnancy, maybe you might consider not getting the vaccine because you consider yourself really safe because you don't hang out with anybody outside of the home. You also have to think about anybody else that's coming into your home too. But I do think it's a risk-benefit question, and there's very much a risk if you don't get the vaccine and you get the virus. The disease is still very strong.
That's a very good tips for the citizens and the community. Yeah, very good. Thank you so much, all the panelists. Really appreciate it. So that brings another question to me. So which are the main distribution places for the vaccine? Is it something that goes out to the CDC guidelines and all the CVS and everybody's going to have it very soon? Or what are your thoughts and what do you think? But you must be getting a lot of calls from the viewers and from your patients too. So Vijay Sharma, would you tell us what's...
So right now in America, I will ask Nikhil Venkat. We have a Moderna vaccine, and we have Pfizer, BioNTech, and we have now Johnson & Johnson's. The initial guideline was frontline and elderly person, then 1B, 1C, and I believe sometime back they open up for anybody who has high-risk conditions. Counties, the system to begin with was great, okay, and it's still working very great. All the counties, they registered, okay. First thing, the hospital gave to all the healthcare workers, and the counties start giving the high-risk persons, okay, and then come the person with high-risk conditions who are relatively younger, to begin with 65 plus, and then anybody under that with high risk. most of the pharmacies are doing it. They're trying to maintain standard as recommended by the CDC. 3 vaccines are available in America and more are coming. And many are in pipelines. So I believe in next few weeks or so, more and more vaccines will be available. Okay, right now, still some people are still struggling to get the vaccine, right? And some of the deserving people are trying to get the vaccine. But I think it's still available, and every week or so when they get it, more vaccines are coming. And Dr. Biani can say what is happening in the state of Texas and our DFW Metroplex. What is status?
Yeah, sure. So it is more of on a supply issue, and as we see more vaccines being rolled out, our larger counties like Dallas and Tarrant County will definitely see an increase in supply, and also Collin County and Denton County. So I think a lot of it has to do with, it's just the supply. A lot of it is how much, and also from the federal government, how much is being allocated to our larger counties. Hopefully, with President Biden here wants to get, so far it looks like we've, in his first even 100 days, he promised 100 million vaccines. We're getting there. And I think we will see by summertime a large number of folks even vaccinated. And, hopefully we will start getting our adolescents vaccinated too by the summer.
How about Dr. Nainesh Shah?
So the vaccine at the beginning was very hard to find. I'll say right now it's much easier. The quickest way to get the vaccine is you got to go online and you have to go to these websites. The biggest places that have vaccine centers are going to be the individual counties themselves. So the county health department is administering the vaccines at multiple sites. And I know we have viewers from all of North Texas. So Dallas County, Collin County, Tarrant County, Denton County. Those are the 4 main ones that I know in our area. And they all have a website where you can sign up and register for the vaccine. At this time, I know I can tell you the Dallas County website, they're allowing for anybody that is 50 years or older can get the vaccine. Anybody who is between the age of 16 and 50, if you have a health condition that makes you at high risk for disease with coronavirus, then you can also get the vaccine. But 50 and above, even if you're healthy, you're eligible at this point. I think yesterday the US hit 3 million shots in one day. And so we're really ramping up the number of vaccines that are available and the number of vaccines that are going into arms. Just the different systems where the different vaccine clinics are a lot more efficient now, and the supply is going up. And so if you haven't already, the recommendation actually is to sign up for every county's wait list. And so if you go to the Dallas County website, sign up for their wait list. If you're go to the Tarrant County, go to that website, sign up for their wait list, and just go through it. And once you get your vaccine, you can go to the other websites and remove your name so that other people can get it. But if you qualify, and even if you don't qualify, you can go ahead and register your name. They'll call you whenever your name is up and your group is up. And so it's never too early to register. Go ahead and register at all of the county websites, and then also CVS, Walgreens. I think Walgreens is administering a lot right now. You can go to the Walgreens website, put in your zip code, and they'll let you know if there's any appointments available, and keep checking that as well. But those are some of the opportunities, and like was mentioned, I think in the next month, we're going to move through this really quickly, and it's going to be much easier to get the vaccine.
Oh, no, that's a very good tip, Dr. Nainesh. So I got one quick question from the viewer. It says, if I had COVID-19 and tested as a positive, should I still get the vaccine? And how long that after my illness do I have to wait? Dr. Nainesh?
Sure, yeah. So the recommendation is, yes, you should still get the vaccine. Coronavirus affects people in different ways, and we really don't know, depending on how the virus affected you, how strong of a response that your body made. And so the way our body works is that we get an infection and then we learn how to fight that infection and we keep it in our memory. And next time we're exposed to that infection, we remember, hey, I know this coronavirus, and I go out there and I kill it right away. And usually the more the virus affects you, the more you remember it. And so in everybody who gets coronavirus, we actually don't know how strong of a response that your body has, so that the next time you get exposed, are you going to kill it immediately, or are you not going to recognize it? And is the virus still going to cause you problems? And so we still recommend, no matter what, for everybody to get the vaccine, because with the vaccine, we know with the studies that your body will build up enough of a response that it's going to remember the next time that you get exposed to that coronavirus, and it's going to go and kill it really well. And so even if you've had coronavirus before, the recommendation is still to get the to get the vaccine. And they recommend as soon as you start feeling better that you're eligible to get the vaccine. There's one exception to this, is if you've received any sort of medicine for treatment of coronavirus, including the antibodies or plasma transfusion. So if you go to the hospital or to anywhere where they give you antibodies or plasma, the recommendation is actually to wait at least 90 days, because it can cause your body not to actually take the vaccine. Those medicines may actually fight the vaccine, and you may not actually respond to the vaccine. So the recommendation is wait at least 90 days if you've received those medications. Most people listening to this webinar probably won't even know about these therapies. They won't have received them. But if you've received plasma or monoclonal antibody, the recommendation is to wait 90 days.
That's a very good analogy. How about Dr. Nikhil and Dr. Vijay Sharma? What do you want to put something on it?
Yeah, no, that is a very good point, that if you receive the monoclonal antibody or convalescent plasma as a treatment modality for COVID, you had to wait 90 days. Now, if you've just had mild symptoms, definitely of COVID, you do want to get the vaccine. However, it is recommended to wait at least 14 days from the onset of illness and resolution of symptoms to get the vaccine. And a lot of that has to do because, the way Dr. Shah explained it, your body's immune system is fighting off the infection. And as your body is fighting off the infection and as everything is settling down, that's why you want to wait and give the vaccine. Also, another thing that's very important, let's say if I got a flu shot, of course, we're out of the flu season, but just assuming this is, let's say, December, I got the flu shot today, I should wait at least 14 days before I get the COVID vaccine. And the reason being is you don't want to be giving multiple vaccine. You don't want to be given the COVID vaccine when you've received another vaccine within the past 14 days, especially like the pneumonia vaccine or the measles, mumps, rubella. Wait 14 days prior to getting the COVID vaccine. And the reason being that we really don't know if there's going to be cross-reaction between a lot of these vaccines. But the second thing is, especially when you go to these vaccine clinics, you will be asked, have you received any other vaccinations in the last 14 days?
So I want to add, Dr. Nikhil Bihani says, normally other than COVID vaccine, we give multiple vaccines together many times. But we are talking about inactivated and live vaccine. Live vaccines are absolutely not. So since we do not know about COVID vaccine, how it will interact, so no two vaccines 14 days. So if I'm right, I did talk to Dr. Bihani a couple of times. So 14 days, any healthy person who did not take monoclonal antibody, right? And 90 days who got monoclonal antibody or plasma. I have a question. Sometimes they give plasma for other different reasons, but that's not neutralizing plasma. Mm-hmm. Dr. Bihani, you got my point. So suppose patient get plasma for some other reason, and we do not know this. So that plasma or that blood product doesn't count, or we do not know much about that yet.
No, actually, that would not count. It is any COVID COVID-specific therapy.
Plasma.
Yeah, like convalescent plasma for COVID and monoclonal antibody. That was a very good point because the CDC actually, they have a very nice FAQ section on the vaccinations because there are a lot of folks with multiple sclerosis who get monoclonal antibody therapy, and it won't interfere with the COVID vaccinations. So it's anything that is directed towards COVID that you want to wait for a period of time.
So that raises another question. It's like a flu. Will there be a need for booster after the COVID vaccine series?
Well,
is that a related question?
Well, I'll tell you this. This is where this is right now the hot topic in COVID research right now.
What was the question again?
The question is, like a flu, will there be need for booster after the COVID vaccine series?
All right.
Okay, time will tell, right?
So,
Go ahead, Dr. Mann.
yeah, so that is the hot research right now, and Moderna actually is carrying out the trials. Because as we see different variants of the virus appearing, and if we are seeing that the vaccines that we have received are not as effective against the variant, then you definitely would need a booster. And that it's going to be very similar to like the flu shot. I mean, I'm not going to guarantee anything, but the way I have been reading things and discussing with other ID experts around the country, you know, as a matter of fact, every Saturday afternoon, the Infectious Society of America and the CDC have a webinar at 2 p.m. Central. And today, one of the topics was the vaccinations and also the variant strains. And discussing with these colleagues that I've interacted with, I would say that we're headed in the same direction as the influenza vaccination. Probably we are, most likely we're going to need a booster. And, you know, just because, you know, the UK variant is a predominant variant, do we need a booster? Probably right now the vaccine we have will get us through based on the research we have. But I'll tell you, we will have more information on this coming out later on because the NIH is right now doing clinical trials on the vaccines against, you know, variant strains.
How about Dr. Nagesh Shah? Do you want to add anything to it?
No, that was great. I mean, right now we really don't know. I think we're all hoping and praying that we won't need this and this will kind of just solve all the problems. But as we've seen, the variants are already starting and you know, depends on what's to come or how is the virus going to change. And what we've seen is that the virus is able to change. And so if it changes enough, we probably will need a booster. And so as Dr. Bayani said, you know, the studies are underway, luckily, and hopefully our response time will be quick if it is needed.
Right. How about Dr. Sharma?
So what you are asking this question based on H1N1 flu came and they now added permanently into flu vaccine, right? They combine it. So we are getting that every year. So as both experts said, we do not know at this time that COVID vaccine will be likely we have to get every year or the time will tell, I believe, and we have to see. This is novel virus, and we'll go from there. So nothing additional to say about that.
Yeah. So no, great. This is almost on top of the hours, and we like to bring President-elect Urmit Juneja and from India Association of North Texas, and he's going to be the president in 2022. So Urmit, please come on and say a few words for this.
Thank you, Shailesh-ji, and thank you all the panelists, Dr. Sharma, Dr. Shah, and Dr. Bayani. You know, what a great discussion that's going on. You know, amazing to learn how the vaccines work. You know, how you can get, whether it's possible to get a Pfizer shot first and a Moderna one next, or whether if it gets mixed up, is there any issue? A lot of clarity that it doesn't really, mess up with our DNA or anything like that, because a lot of people are concerned with, how the mRNA techniques work. And also amazing to notice that we are now getting 3 million doses a day. That's amazing. So we are all looking forward to getting our vaccines very soon. And make sure that everybody remains healthy and gets the vaccines on time. Also, I'd like to thank all our IANT volunteers and my colleagues in IANT who have really done a great job putting this webinar together for the viewers of DFW. We have Surjan, Dinesh, Mahindra, Chandrika, Sushma, all working in the background to make this happen, and under the leadership of our current President Shailesh ji. So thank you all again very much. And that's it. I'd like to hand over to Mohammad Farshori Salman, who is our trustee co-chair, to say a few words. Thank you so much.
Thanks, Sharmeet. Thanks, Shailesh bhai. Thank you to Dr. Sharma, Dr. Bayani, and Dr. Shah. Thanks. Very informative session. Need of the hour. A lot of questions around in the community, and a lot of misinformation too. So this really helps. Appreciate your time and appreciate your support, and to also all the frontline, the medical community out there for the phenomenal work, the impactful and inspiring work for helping communities across the globe, in the U.S. and Texas. So on behalf of India Association of North Texas, we really, really appreciate everything that you guys have done. These are challenging times from multiple angles, not just from a COVID angle. They're challenging time for the Asian American community. We stand with all of our Asian American Pacific Islander brothers and sisters, with every community that is going through a hard time, and we'll continue to support for all the listeners. IANT is here to provide those platforms, those resources. Please feel free to reach out to Shailesh bhai, Chandrika, or me, Dinesh, whoever is on the call, or just reach out to us, and we are here to support you. Thank you. Back to you, Shailesh bhai.
Right, thank you so much, Salman bhai, and thank you so much, Umit. So we're going to continue our second session of question answers. So the next question that I've been getting, Dr. Shah, is the youth. So what is the age limit for the youth? That's one question. And the second question that I had is, so once they take the COVID dose, are they going to allow the school? And if you can elaborate more on like the age limit for the youth and how is the school situation going to work? Then after we go for the next question.
Sure. Yeah, I'll get started. The vaccines that were studied, there was one that was at 16 years of age and the other one 18. So the youngest you can be to get any vaccine is 16 years old, and there's active studies ongoing right now with children that are younger than 16 years old. And so hopefully within the next few months, maybe it might take up to even end of the year, that we'll actually have those studies conducted so that we can say that it's safe enough for children that are less than 16 years old. But right now the cutoff is 16 years old. And in terms of the schools, I think all of the school districts are doing something different. Not everybody is doing necessarily the same thing. In general, I think more schools are going back to in-classroom learning, and getting less and less virtual. And a lot of school districts still have kind of the option between the two. And when they're at school, the recommendation is still to, try to wear the mask, try to physically distance yourself. I don't think any of that is going to change anytime soon.
How about Dr. Nikhil?
So, in terms of, that's correct. Moderna actually just enrolled, children and adolescents in their trial, and hopefully we'll have data on that in the next couple of months. And of course, for Pfizer, you can be 16 years and older. Now, yesterday, the CDC did revise its guidelines in terms of schools that, if the kids are wearing masks, they can be 3 feet apart versus 6 feet. So it looks like this will be a game changer when it comes to reopening these schools. And that's great because this guideline actually was endorsed by the American Academy of Pediatricians about in the fall in terms of schools reopening. And also there have been quite a bit of experts in, in infectious disease society of America, the epidemiologists, and they looked at schools have not been proven to be what you call a super spreader for the virus, And that makes perfect sense. But the problem here becomes is that our kids, they could be at home on virtual learning and say, okay, you know what? I'm going to go back next week to class. Well, guess what? They were next to Aunt Sally who had COVID. Now they might be asymptomatic, but they're a carrier. They come to school, they can spread the virus. That's where the problem happens. When you come from the community to school, it's not within the school per se.
Dr. Biani, I have a question. So 3 feet with mask, without mask, that's number one.
It's 3 feet with a mask.
Right. The second question, remember, we think schools are number one focus of infection, and when we treat teachers are high risk because of the exposure to students. And I know why, if they open the school could be a big problem, maybe big outburst, maybe since we close the school, that helps. And the last question what is the reason that 16, they had the cutoff age for the vaccine? Is this based on some immunity, based on that they are not getting infection, based on it's not or is this immune system? I am not catching, it's nothing hitting in my mind. 16 or 17 and something, just because the availability or they are low risk.
So I know that from the Pfizer trial, there were 16, I think a lot of it has to do with the study size and who was enrolled. That's one big thing. But the other thing about children is that the immune system, are their cell-mediated immunity highly upregulated just because they're exposed to various vaccines, respiratory viruses like RSV, influenza, just because could their cell-mediated immunity be upregulated? That is what I postulate. That I'll tell you, with this whole COVID, why are we seeing different folks around the world who are reacting differently versus certain communities? The big question that comes up, for example, in India, is that they have far fewer deaths than we do here in the United States. And one of the reason could be is the cell-mediated immunity. There are two types of immune systems here, that our body produces antibodies, which is what we call humoral mediated immunity, and the other one is cell-mediated, which our cells in the immune system are responsible for fighting viruses and parasites. So on the flip side, the kids here are exposed to all sorts of respiratory viruses. So there might be some degree of upregulation of that cell-mediated immunity, which protects them more so than the others, especially as you get older. And when we look at India, for example, people there are exposed to all sorts of viruses, parasites, and also the population in India is relatively younger than the United States. And also another big factor that comes into play is obesity.
So talking about India and other countries, so what is the new CDC policy on quarantine after international travel? And how do we deal with the US regulations versus various visiting countries' rules? Is anything that you can share with our viewers?
So that's one thing I always do. Every day I go to the travel section of CDC to see if there's any new updates. So far, nothing really has changed just because of the variant strains that are emerging in various regions of the world. So what happens if the State Department and the CDC have broken down these countries into 4 levels? I would say about 75% of the world is level 4, which pretty much means that even though you've been vaccinated or unvaccinated, if you travel to, let's say, for example, let's pick on India, for example, because it's listed still as a level 4 country. Upon arrival, and actually prior to departing from India, you have to have a negative COVID test. But then once you arrive into the United States, you have to be in quarantine for 7 days, provided you get another COVID test 3 to 5 days arrival into the United States. And even if you don't get that COVID test, then you would have to stay in quarantine for 10 days. Now, the CDC might change these travel guidelines for those who have been vaccinated. And the reason I bring this up is a couple of weeks ago, the CDC said that if you have been vaccinated and you're around with somebody who has had COVID, you do not need to be isolated. And I actually was about to email someone over at the CDC about this. This is along the same lines. If somebody's been vaccinated and they have traveled overseas, why should they quarantine?
Yeah.
So there is going to be updated guidance on that. The CDC did not roll out the travel guidance for vaccinated people because they just did not want to make the matters confusing. So I guarantee that in the next couple of weeks or months, there should be some change for vaccinated folks who do travel overseas.
How about Vijay Sharma? You might be getting a lot of calls for the travel, right? Because you have good...
Right. So what I was reading, correct me, Dr. Biani, CDC says, if I'm vaccinated, fully vaccinated. Let me clarify for the listeners. Fully vaccinated is a person who is 2 weeks after the second dose of 2-dose vaccine or 14 days after the 1-dose vaccine.
Right.
14 days after.
It's 14 days after the second dose.
After the second dose of 2-dose vaccine or 14 days after 1 dose for the 1-dose vaccine.
Yeah, for the Johnson & Johnson. Right.
That's called complete, fully vaccinated.
Right.
Fully vaccinated, exposed to fully vaccinated, can do without mask. That's what CDC, I think that's the only one guideline I will buy from the CDC. Otherwise, say if you know somebody doesn't have symptoms, you don't have to be, but I don't buy that. If you don't know anybody and you are in the masses, you better protect yourself. I was in a meeting recently, nobody, medical doctors, attorneys, social workers, many people, nobody was wearing mask. I don't think everybody is 100% vaccinated there. So let's not be bold enough. Even after fully vaccination, question comes variant, question comes something else. So just take precautions. Simple mask could help. I think that's Dr. Biani mean to say. Nobody's going to ask you. Yes, one thing well, I have a friend of mine whose daughter is getting married and they're asking you vaccination status. So it's a very good point. So we as a society should also give input along with the CDC recommendation, along with people like me and you, what I was saying. So common sense still prevails, number one, and universal precautions should be considered as much as possible. If nothing, hand wash and mask. I don't want to say anything against the CDC or open states. So.
No, I mean, that's a very good point you bring up. And what I'm trying to get at, let's say if I'm fully vaccinated and I have been to India or I've traveled to, let's say, Brazil for that matter, I'm wearing my mask, even though I come back to the United States, do I still need to quarantine after I've been fully vaccinated? I think that's the main thing. And definitely you do not want to let your guard down. Just because you are fully vaccinated does not mean, okay, you know what, I'm not going to wear a mask. I can go wherever I want. Because what Dr. Sharma makes a very important point here is the variant strains. You don't know what variant strains are prevalent in the community. And that's why, even though you're fully vaccinated, you still want to wear your mask.
And if you have a function, ask the people you are inviting, are they vaccinated or not? It's a good point. Right. That's public awareness also.
Anything else you want to add, Dr. Shah?
These are all great points. Once everybody is fully vaccinated, and let's say these vaccines, there aren't any more variants, and everybody's fully vaccinated, then the ideal is that we're going to go back to being able to hang out and everything kind of return to normal. But in the meantime, as long as there's somebody around you that doesn't have the vaccine, even if you're fully vaccinated, we want to make sure that you don't spread that coronavirus to them or anybody else around you. And so it's really, really important to always wear a mask for that reason. We've seen so many people come into the hospital and so many people die, and their family members know that they gave it to the person who ended up dying. And just the amount of grief that you go through knowing that even though the virus didn't affect you, you caused the virus to affect somebody else in a way that either they got very, very sick or they even died. And that's kind of in my mind, that's even worse than getting the disease yourself. Like you contributed to somebody else's pain and heartache. And so that's the biggest thing I think I want to just point out is even if you feel like you're safe because you're fully vaccinated, think about all the people around you that may not have the vaccine. Again, we don't know whether or not you're able to spread it to them. If you go out of country and come back, you don't want to be the person that brings in the variant to the U.S. and spreads it. And so that's kind of where the guidance is coming from. I think it's a conservative guidance, and maybe we'll ease up on it as time goes on. But in the meantime, I think wearing a mask is fairly simple. And if it means that you get to save the person in front of you's life, or you get to prevent a big new variant from coming into our community, I think it's a small ask. And everyone's been doing such a great job over the last at least 6-7 months wearing masks that I think the finish line is in sight, and hopefully, another 5-6 months of true dedication to this will be kind of through the hard part.
Yeah, no, I mean, I do agree with that. So that also brings me to another question. So can you reiterate Dr. Fauci's message to the country on preventive care this week in relation to continuing to use masks? So since we already have, just like everybody said, we already have a first dose, second dose, I don't need to be a mask anymore. So what do you suggest to them and to help other people? So if you can just start with Vijay Sharma, then Nikhil Bhai and Dr. Shah.
So I think technically that point comes because Pfizer and Biotech and Moderna, they give you 90+%, right? Immunity. So as a matter of fact, they protect you from the infections. But some variants are left which we are not sure about. So if somebody getting both vaccine, but I say fully vaccinated, the definition I mentioned 2 weeks after the second or the last dose which needed, and he doesn't want to wear a mask, I mean, less likely, I can say he could be protected, but we don't know what we are facing. The known population in your house, maybe in your office, when it's okay, but in unknown masses and big meetings, especially in the planes, airports, or all those places, I think we should use the universal precaution still. And that's my comment on if there's somebody say I'm fully vaccinated. I'm fully vaccinated. In my office, I see patients, they are high risk, so I'll put the mask. In my house, I know four people are there and I don't have to wear mask. I'm okay with that. So some kind of scenario I'm trying to put. So common sense still, universal precaution are there. We still didn't get what they call herd immunity. So herd immunity, based on definition, 60-70%, or either people should have the disease or they have to be vaccinated. Am I right, Dr. Biani? And some people say 60%, 70% vaccination. We didn't get it yet.
Right. No, that's correct. Definitely, it is very true what Dr. Sharma just mentioned. that, even though I'm fully vaccinated, everybody here on the panel is fully vaccinated, it does not mean let's get rid of our masks. Even when I go outside, I go to the gym, I go to the restaurants, I still wear the mask. I understand the state of Texas no longer has a Texas mandate for the last 10 days, but it should not be in lieu of common sense because we have variants out there. We also don't know who's been vaccinated, who's not been vaccinated. And even those folks who have been vaccinated, we don't know if they have developed immunity from the vaccines. So we want to keep everybody else around us safe, keep ourselves safe, of course, keep our elders safe, and those who are immunocompromised. You definitely still want to wear the mask. That public health guidance will not change until for sure we know every community here has reached herd immunity.
How about Dr. Shah?
Yeah, I completely agree. And, the one thing that I think several people, it's easy to forget is children. And so, children, as you mentioned, they're not getting vaccinated. And so they're always at risk. And so that's, the one people in your household that can continue to spread the disease. And so, whenever you think about, oh, is everybody here fully vaccinated, or I'm going to this event or this social gathering and everybody's vaccinated, remember that children that might be there, if they're less than 16 years old, they're not going to be vaccinated. So, you can't think that everybody's vaccinated because there are going to be people that are not vaccinated. And in that case, make sure to wear the mask anytime you get together, especially indoors. If it's somebody outside of your own household, especially if anybody there has not been vaccinated, definitely please wear a mask and continue practicing the universal precautions, hand washing, staying apart from each other.
So that brings another question to, for a larger population who were used to working in the office area and office environment, what is your opinion return to work look like? What will be the difference, and what are the things that you suggest for them to take it? And do you think it's going to be going back to quarter 3, 4 or anything sooner as per the CDC guidelines? Vijay bhai?
So I agreed to relax the restriction, but I disagree to remove the restriction. Let's put it that way. And I called Dr. Nikhil Vianney many times on many questions. Okay, if you go by the incubation period, 2 days prior to patient gets sick, could be contaminated, infected. 3 to 10 days, average 7 days. You can still transfer the infection. Yes, if you are positive in my office and 7 days after that you're fine, I may let that person come, go to office with universal precautions. Maybe in the large population, if the person is in private room, cubicle rooms, and use the precaution. So if it's positive, I don't think 7 days we say that because a couple of days before that he's infected, and then 7 days, 9, 10 days, I think that's when the peak falls down. Still, we are adding the mask and the hand washing and 6 feet distance. I think that's pretty fair to say. Anything, Dr. Vianney, you want to add?
No, I think that's a very fair statement that, we should not totally, as we do come back to work, and I'll give you my example right now that within Texas Health Resources, our office is over in Arlington, and we have limited people who are coming back over there, but they did a survey to find out from all the employees that would you want to come back to work and how are we going to have people come back? And a lot of folks still felt very comfortable that, don't remove any restrictions, just ease up on restrictions and just come to office if needed, if we have to meet in person. But otherwise, I think the way we're doing business right now, I think it's going to be so-called the hybrid model that you come to the office if you need to have a meeting, otherwise, work remotely.
How about Dr. Nainesh Shah?
Yeah, I completely agree. You know, every business is going to be different. Small businesses can monitor, you know, if you've been vaccinated or not, if you have a small number of employees and things like that. But, you know, I think what this last year has proven is that we can do a lot of things virtually that we never thought we could do before. So it seems like most businesses are able to continue their operations, even with a lot of people being virtual and at home. And so I think until we reach that point where we have that herd immunity, the cases are not spreading, I think we're in this at least the next 4 to 6 months.
So there was a news came in as per the latest information in Dallas, locations canceled after known session for vaccination appointment for today. So due to vaccination shortage, are you aware of this, any supply shortage or any issue? I know a couple of weeks ago we have some issue with the cold weather related, but do you know anything otherwise? Is any issue in the supply chain right now, or what do you have experienced before?
I think a lot of it is the supply chain. I mean, I think there's just more people who want to get the vaccine, and you know, probably the supply is being overused. I mean, I can tell you from what I'm hearing from others that there's a lot fewer vaccine doses or vials going to waste than early on, because I remember when I was in the first group of people who got the vaccine, like 5 days after it was released, a lot of our employee health nurses were concerned that, you know, we're only vaccinating only about 60% of the employees. What are we going to do with these vials that are open? And last week I was talking to another employee health nurse, and she literally said that over the past few weeks that the number of open vials that have gone unused has just decreased substantially. So there's more and more people in the community want the vaccine, and I think the supply will be ramped up soon.
How about Dr. Ninesh?
Yeah, I imagine it's just a hiccup in the supply chain. What I'll say is the other way to look at this is the good thing is that our operations have really picked up. You know, at the beginning we were only able to give, you know, 1,000. A lot of sites maybe a couple hundred vaccines a day. Now we're talking, you know, tens of thousands of vaccines in the Dallas-Fort Worth area being administered every single day. And so with that comes we need a lot more supply. And luckily up till now, I think the supply and demand, or supply and the operations of actually giving the vaccine have kind of matched up. We're becoming, again, very efficient. The sites are very good about how to get people through and get the vaccine going. And with I believe the FEMA support, we've added even more vaccine sites. And so at this point, I think the operations are working really well. And the supply is continuing to pick up, and it needs to continue to pick up.
Dr. Sharma?
I think they know what's happening. It could be simple counting error, technical error, maybe they used or something else happened, you know. The chain supply comes the temperature maintenance, they have enough doses, or they move some high priority cases since this snow and this storm happens. Some people are more sicker than others. It's difficult to speculate, but supply chain is the number one. It covers almost everything.
Yeah. So since, you know, COVID-19 as a non-medical, we've been learning a lot of terminologies and everything nowadays. So there's one question came in the chat right now. It says, what are monoclonal antibodies? What is that? Can you just explain?
So what the monoclonal antibody is, these are antibodies that are synthetically created, and they mimic the sort of their antibodies towards the spike proteins of the virus. And we usually give those monoclonal antibodies to those people who are in the outpatient setting with mild illness. And the purpose of giving these monoclonal antibody is it's sort of like if your body has a mild illness and needs a jump start, you give them monoclonal antibody to help facilitate in preventing the worsening of the illness, which would land them in the hospital. And the monoclonal antibodies have shown to reduce that hospitalization in the folks who are over the age of 65 and those folks who have immune systems that are compromised. The way I would look at it this way, it's like, if a cup of regular coffee does not cut it for me, I really need to stay awake, I put a double shot espresso in there to boost it up, and then caffeine boost. This is a way of boosting the immune system.
So this is right, Dr. Biani, this is neutralizing antibodies.
Right, they're neutral.
Neutralizing mean the virus is injecting antigens, virus inside, right? It creates antigen response and cytokine storm and all those things. The neutralizing antibody, monoclonal antibodies are neutralizing antibodies, and it try to fight against the virus. And if we can stop that fight right there, and rest of the recovery is for the inflammatory process. Right. So this is after vaccination, which is proven, where we have acquired immunity, we inject it. So this is kind of passive immunity we are giving to the person to fight. We are giving this serum or plasma or monoclonal antibodies to these people. It's still an experimental, am I right, Dr. Biani's emergency use is approved?
Right. It is. It is only. It is correct that it's only. We only have emergency use authorization for monoclonal antibodies.
And there's no definite studies how effective. I have two patients, one survived, one didn't survive. They both got it. I know them, but many of them, they got it. And there's criteria to get monoclonal antibodies lined up. Sick person is more than 60 or oxygen low. Is at this time it's given as outpatient, but many hospital or ER, when patient goes, they try to give the prescription. It's given as infusion, and I believe Dr. Biani, I talked to him a few days ago. It's given as outpatient also these days. Pretty expensive though.
Right. I mean, it is. Let's put it. It's a laborious process. But the way I look at it is if it keeps the patient out of the hospital and reduces the severity of illness, then it's worth it. When everything is said and done, because, I was involved in the operation, the strategies here for Texas Health, that by the time the person gets the appointment, they come to the infusion center, it's a 1-hour infusion. And then you have to watch the person for at least another hour, make sure they don't have an adverse drug reaction. And then you send them home. And then before you bring in the next person, you have to clean everything down. And that can take another hour. So by the time you get another person to literally in an 8-hour day, you can only probably do 2 people at once, the infusions. But we had various infusion centers and clinics that were administering the monoclonal antibodies.
Yes. And only a couple of companies in USA, they got approved, and I think US government has bought and they're administering.
Well, going along the lines of the monoclonal antibody, and it just came up in the news a couple of days ago, and even in our IDSA briefing, was that the government is actually limiting the distribution of these monoclonal antibodies to areas that have an increase in different variants. Because these monoclonal antibodies, so a virus that has no mutation is called wild type. So when these monoclonal antibodies were developed, they were towards the wild type strains of the virus. So if you have a predominance of variant strains in your community of the viral strains, then what's the point of giving the monoclonal antibody? So they have restricted the shipment of monoclonal antibodies to certain communities because of the increase in variant strains.
So what is
to add a point, Mr. Shah and what Dr. Biani Nalisha. So this is one of the plasma. If you get, when COVID is positive, you cannot get the vaccine for 90 days. That's the point I want to add. Yeah. Remember, you asked this question in the beginning. So this is one, if you got the monoclonal antibody, you have to wait 90 days. before the vaccine. This is the plasma we're talking about, this monoclonal antibody we're talking about.
Right. How about Dr. Nilesh Shah?
I guess let me take a step back. I kind of wanted to talk about how the virus actually affects you. So once the virus gets into your body, if you have not been vaccinated, once the virus gets in, it takes a couple days before it causes you to have symptoms. And usually what people will feel is fever. They'll feel like they just feel tired, kind of like you have the flu, same thing. And usually at that point, they're not feeling like they're having any trouble breathing necessarily. It's really just very vague symptoms, fever. And this is the point in time when the monoclonal antibodies, if you're high risk, that they would actually help. As Dr. Sharma said, they neutralize, and so they basically fight off the effect, and they fight this virus while your body's still trying to learn how to fight it itself. If you don't get those monoclonal antibodies, number one, we still don't know exactly 100% how it's going to affect every single person. We do know that we think it helps, especially if you're high risk. It prevents you from getting the severe illness. But let's say you don't get the antibody. What ends up happening is a lot of people, after about a week, they start feeling better. And if you start feeling better, that's great. And a lot of people, they won't feel anything else, and that's kind of it, and they're done. The people that we worry about, at about 7 to 10 days after they get the virus, they start having a lot of inflammation in the lungs. And that's when they start having problems with oxygen levels. They're not getting enough oxygen in the blood because there's too much inflammation in the lung. And so that's really the troubling time period is about 7 to 10 days after you get the virus in your body. And then at that point, the virus itself isn't causing a lot of problems, but it's this inflammation that causes a lot of problems. And so with this monoclonal antibody, if you get it, and that's why it's for people that are as an outpatient. Usually the people in the first 7 days, they're not in the hospital. They're feeling fever, they're feeling a little tired, but that's about it. And by the time you make it to the hospital, typically, if you're sick enough to go and get admitted to the hospital, you're having problems with oxygen. And at that point, it's already about 10 days after you already got the virus. At this point, the virus, your body's already killing it. And it's probably doing a pretty good job of killing the virus. And that's what's causing a lot of the inflammation. But that's why the antibody is not given to people that are already in the hospital, because at that point, it's too late. It's really good early in the early stage when your body has not figured out how to kill the virus itself.
Good. So that brings another question. So what is a high transmission community, and what we as a citizen to avoid contributing to this situation? Vijay bhai?
I'll ask Dr. Bayani to answer that question. High transmission community.
Again, the question is, what is a high transmission community, and what we as a citizen to avoid contributing to this situation?
Right. So it's more of an epidemiological question. And when you have a high transmission community, of course, it's set forth by your health department and, the magic number, of course. Here in Texas, we have different regions. So here in the Northeast region, if our infectivity rate is more than 15%, which is 15% hospitalizations, for example, then that's when the businesses have to start scaling back. That's where you have to adhere to, okay, fine, your county now said restaurants, stores, 50% capacity. This is where everybody who goes out needs to wear a mask. You might need to even impose curfews. That's the definition of a high transmission community. And what you can do to help flatten that curve or that infectivity rate is do your part. Stay home. Wash your hands. Wear your masks. Now, that was the question early on, before even the vaccines were out there. So that is what the definition of the high transmission communities are. And that's why the public health guidance still is very important.
So I think based on that, our governor made some decision. Maybe it's much lower than 50% now. Do we know, or do we calculate? Curve has flattened, definitely.
Right. As we can tell from hospitalizations, and usually, Dr. Shah will probably have a better explanations because he's over at Parkland, UT Southwestern, bigger hospitals. I can tell you in our community here in North Fort Worth, for last 2 days, we didn't see a single new COVID patient in the hospital. And obviously the number of COVID patients we have within Texas Health Resources has dropped to under 200. So we're under 200, which is really good. So that means about 6 to 8% of our beds in the system are COVID beds. When we had our surge in January, our peak was at around a little bit over 1,150. We were very close to 1,200 patients at one point. And our beds, 33% of our beds within the health system were COVID beds. So that means 1 in 3 patients in the hospital were COVID. And now we definitely have substantially gone down. In terms of the state infectivity rate right now, the state infectivity rate is at around 13%. We still can do a lot better. Now, after spring break, it will be very interesting to see if that number goes up, or does it stay stable, or does it go down? If it goes down, that's great. But if it starts going up, then obviously it is, time to sound the alarm.
Yeah, also at Parkland, the numbers are definitely going down. We're still seeing a handful of cases get admitted, sick enough to not only come to the ER, but also get admitted to the hospital every single day. So we're at our peak, we were admitting about 25 to 30 patients a day. And then they end up staying some people stay for months, but some people stay for usually about 7 to 10 days. Now we're averaging about 2 to 3 admissions coming into the hospital and staying in the hospital per day, which is much better, but it's still not zero, and it is spreading through the community still. And I think everybody fears what's going to happen with spring break as people let the guards down, as the mask mandate has gone away. Hopefully, it seems like a lot of restaurants and stores are still enforcing a mask mandate, which is great. And just like every time else that we've seen this, the important thing to remember is that our actions today will show in the numbers 3 to 4 weeks from now. And so by the time we start seeing a rise in the cases, it's already too late. We definitely need to start changing our behavior. But at that point, it's going to take another month or two before our behavior actually impacts the numbers. And so, we won't see the effect of spring break for several weeks later. And so, I wouldn't be too reassured if the numbers don't go up in the next couple of weeks. It's important to continue to keep a close eye on it, because a month from now they may start going up, and it's because of what we're doing today.
Yeah, that's good. Thank you. Dr. Sharma?
No, I think they said enough about this point. We can talk something new.
Good.
Point.
So, right. No, but so this is good. And right now we're almost at 3:40, and we'd like to hear from you, all of you as a panelist. What are the tips that you can give our community here, and what are the other information you can share to our viewers so they can take it the next level and help others also? So let's start with Vijay Sharma.
Number one, as we mentioned, try to maintain universal precautions still. Mask, hand wash, and distance. Number two, go get the vaccine. To answer the question, if you are looking for vaccine, you will find it. It may be a little far from you, but you can get it. And get whatever vaccine is available. And complete the dosing. Okay. Talking about the vaccine, and I get called for who should not get, who has medical condition or a simple allergies, not a problem. If you have some anaphylaxis reaction, severe allergic reaction, to anything, anytime, then you be careful and discuss. And as Dr. Biani said, I send patient to allergist. They are going to analyze what kind of allergy reaction you have to it. The second thing, if somebody got even smallest allergic reaction after the first dose of vaccine, I think CDC guidelines say that try to avoid the second dose. I have one patient who came to me, small rash, elderly lady. So we decided, or you should consult the allergist. So universal precautions: 1, get the vaccine; 2, and talk to your healthcare provider about certain conditions. Should you get it or not? If there's an apprehension, you can talk to me. Dr. Nikhil Biani is my source for many years. Dr. Nagesh is there, and then many other IANT infectious disease doctors. You can talk to CDC, get it very much clear. If you don't want to take the vaccine, why you do not want it? I had talked to many people. Some people have some belief. Even the federal government tried to clear certain doubts. Some people thinking they are getting inferior vaccines. There's no vaccine which are approved by FDA is inferior. I think any vaccine which more than 60-65% the immunity protection is good enough. And Pfizer and Moderna giving 90+%, and even the Johnson Johnson maybe 65%, but in a highly sick patient maybe up to 85%. So get the vaccine, and still watch. And in the end, like a friend of ours, if you invite somebody to your home, if you're going to have parties, weddings are coming back to schedule again. Ask your guests, are you vaccinated or not? And the rest is up to them. And so Dr. Biani and Dr. Nagesh will add something more to that. Thank you for the time also. And I'm available as IANT, as a TIPS member, as a community in Plano. Anybody can call me. IANT has my number. They need my advice. I'll be available anytime about that. Thank you, sir.
Dr. Sharma. Dr. Nikhil.
Yeah. So no, that's a very good point. Even though we have been fully vaccinated, we should still follow the public health guidance, because what we do today is going to be a predictor of what's going to happen in a couple of weeks, could be months. So we should not let our guard down. Even though more and more people are getting vaccinated, we should still continue wearing our masks, practice good hand hygiene, social distancing. And also another thing, this question has come up many times, and there are a lot of people who think that the FDA here cut corners and got these vaccines rolled out under emergency use authorization. That is not the case. The reason these vaccines, they went through the same trials, same Purdue process as the other vaccines that are available to us on the market. The reason these vaccines rolled out much faster than the others is because this was a multinational effort. A lot of countries were pouring money into the research and development of these vaccines. United States and Germany were the biggest ones who contributed to the Pfizer BioNTech. And of course, we know about AstraZeneca. The Serum Institute of India poured a lot of money into that. And a lot of countries in Asia, Africa, Europe, the governments really got involved. And that's why we were able to roll these vaccines out, hence the name Operation Warp Speed. So definitely get the vaccine if the opportunity is available to you. Do not delay. Thank you.
How about Dr. Nagesh?
All great points, and thank you all for hosting this webinar. It's been great. I think one of the other things that we haven't mentioned yet is just the side effects of the vaccine sometimes that people can feel, and so I just wanted to touch on that a little bit. Most people feel a little bit tired. Some people can get a fever, especially after their second dose for the 2-dose vaccine. Nothing that's very significant, nothing that comes even close to the stuff that you would feel with coronavirus. coronavirus. And so if you start feeling anything, a simple Tylenol can do the trick. And usually after about 24 hours after you get the shot, after about 24 hours, nobody really feels anything at that point. And so for those of you that have not gotten the vaccine, I've heard other people have had some fever or feeling tired, some Tylenol after you get the vaccine. The CDC actually now doesn't recommend taking Tylenol before, just because we don't know what will happen. So don't try to take it before the vaccine, just in case kind of a thing. Wait till after the vaccine. If you do start feeling something, then you can take some Tylenol and it'll make you feel better. And then the other thing I wanted to mention is the other benefits of masking right now. Every year we talk about flu. This year, the number of people that have been diagnosed with flu, I believe in North Texas, is less than a dozen. And so that's just incredible. And the reason why that exists is because everybody is doing the universal precautions. And so as people stop doing universal precautions, other respiratory, other colds, flu, viruses, other things are going to start acting up. And so, and then the question is going to come up, oh, do I have coronavirus or do I have another cold? Do I have the flu? And so as we're at a point right now where I would recommend for, even if you're fully vaccinated, to wear the mask, because you don't want to confuse what kind of illness you have. If we all keep masking, we're going to keep all the viruses down. And so I think it's going to be very important for these next couple of months that we continue to follow that practice for everybody's sake.
That's a great things, and we learned a lot today as a panelist. Thank you so much, Dr. Ninesh Shah, Dr. Nikhil Bhai, Dr. Vijay Sharma, and on behalf of India Association of North Texas Trustee Board, volunteers, and Board of Directors, we'd like to say thank you so much. And we really appreciate it for your time and educating the community. So we owe you guys. So whenever it's the next event, we'd like to invite you to have a one-on-one and as a group also. So we send you some invitation to come on and have a join with us as well. So thank you so much. And I'd like to give this one to Dinesh Huda. So Dinesh Huda is our joint secretary, and Dinesh is yours now. You're on the mute. You need to unmute.
Thanks, Shailesh Bhai, and thanks everyone for attending today. Thanks to our panelists, Dr. Ninesh Shah, Dr. Vijay Sharma, Dr. Nikhil Bhayani, who delivered great information related to COVID vaccination and time they spared today from their busy schedule over the weekend away from your family for the community. So we really appreciate it. And thank you to Mr. Shailesh Shah, who did a great job in moderating this important topic during this pandemic. It's more important than ever, and we would like to thank all our sponsors who stood by the institution of IANT and believed in what we do for the community by supporting us and continue to support in these challenging times. We would like to thank our various sponsors, corporate sponsors, Heritage Land Bank, Discount Power, New York Life Insurance Company, our gold sponsors, Paul and Geeta Pandian, silver sponsors, Sunil Mani, CPAPC, and Encore Enterprises Inc., our supporting sponsors, Ahluwalia Law Office, PC and SkyPass Travel, our radio partner, Radio Karama, and today's event is live streamed by our streaming partner, Mahamaza. Without support of whole team at Mahamaza, we would not have been able to bring this webinar to you. So once again, a big thank you to all our panelists for today's webinar, IANT board, trustees, and a special thanks to our sponsors. Without these sponsors, our activities would not have been possible. Thank you everyone for attending, and this adjourns today's webinar. Thank you so much.
Thank you guys.